Hi, this is Dr. Lee with New Life OB-GYN and Associates, and we're going live here on Facebook. This is the first time we've ever done anything like this, and I'm definitely not an actor, so bear with me here. But what we're doing today is we have a patient that is getting a hormone pellet insertion, and we do these in our office almost on a daily basis. So the first thing we do is I've prepped this patient and gotten them ready, placed a little betadine. This is going in the right hip area. And what we're going to do is put a little numbing medicine in. I've told the patient if they feel any pain at all, just to let us know while we're doing the procedure. But we just place a little numbing medicine right underneath the skin. And as I put this numbing medicine in, I'm just going to talk a little bit about the procedure and why patients are coming in and getting the procedure done. I've been a OB-GYN here in the Valley for over 4 years and treat a lot of patients for hormone deficiency symptoms. Those symptoms include anything from menopause symptoms. So we treat women in menopause. That's generally women in their late 40s to even into their 60s. And those women that are even pre-menopause will start having hormone deficiency symptoms. Those symptoms can include anything from fatigue, night sweats, poor concentration, irritability, depression, vaginal dryness, dry skin, nail changes, hair changes, low libido. Oftentimes they just, when they start feeling the hormone deficiency, it's fairly obvious. It's not something that they notice in the first few months as their levels go down, but as their levels go down and time continues, they'll start noticing a lot of these symptoms that they've never had before. Often doctors they'll go to their doctor, the primary doctor might check some levels. The problem with checking levels with hormone patients, unless you're in menopause, they often fluctuate. And so those numbers are often at sometimes in the day high and sometimes the day low. And so it's a little bit difficult. I try to treat patients based on their age, based on the symptoms that they have. We do look at hormone levels because it does help guide us in our therapy, but we just don't neglect a woman that's having symptoms and say that their levels are fine, therefore it can't be due to hormones. So many times we have treated women that clearly were having hormone deficiency symptoms, even though that their levels might have been in the normal range. And we've treated them, and they've really improved with a little bit of hormone replacement. Generally, what we use is with the hormone in the pellets is both estrogen and testosterone. Those are the two main ones. Progesterone we normally don't use in a pellet. We normally use progesterone either in an oral pill or a cream format. And so we're pretty much done placing the numbing medicine in. The patient did very well. We use enough in there so they won't really feel anything else. The next thing I'm going to do is with the little scalpel again. She's not going to feel this at all because she's really well numbed up. So I'm going to make a little nick there. You can see how small that is right there. So I made that little nick. And then we just use what's called a trocar, and this helps just guide us right underneath the skin. Now this pellet will last for 3 to 4 months right underneath the skin. It just dissolves underneath the skin. So the benefits of this versus using maybe an oral pill or a cream is that they do not need to place it or take it on a daily basis. So they're able to not have to worry about remembering to take it, and it also gives them, there I am, I'm placing it right there, and so you can see that's the pellet going right down there, and this pellet is slowly released, so they will have this in their system for about 3 to 4 months, and they won't need to have, like I said, the daily fluctuations you sometimes would have with a daily medication like a pill or a cream. And so there it is. That was all it was. The patient did awesome. She had no really symptoms whatsoever with this. We're gonna clean this up. She'll be done. I do check their levels. Generally, a first-time patient like this would check her levels in 5 weeks, see how she's doing, have her come back at week 6, discuss her symptoms with her, and see if there's any adjustments that we need to be made. But as you can see, very quick, easy. She tolerated it well. And if you guys have any questions, we'd be happy to have you come into our office and consult with you regarding your symptoms. All right, you guys have a great day and a great weekend. Thanks for joining us.